One way that we can think about trauma or any health issue is from a public health perspective. And here we're looking at when are there problems and under what circumstances. So that's what we're going to look at today. Um, One example, and an example that Burke Harris uses in her book, is of the cholera outbreak in London of 1854. This was a huge public health problem. 616 deaths of 2 million people in a 2-week period. So a lot of people in a very short period of time. Often they died within just a couple of hours, and no one understood why. And lots of different, from today's perspective, quack cures were used in order to explain and treat people with cholera. At that point, nobody knew about cholera. So this was just completely a new thing. Um, and you can see it in this 1832 cartoon where the London Board of Health Inspectors are looking for cholera. And they're looking for it in terms of scents, um, you know, they're looking down the drains, they're looking, up in upper floors, and there's certainly a financial motive for looking. In, ter in terms of what caused cholera, the common theories were that it was some sort of miasma, bad air, or dirt, or moral debauchery, people who are engaging in bad behaviors were the ones who were going to get sick. And that's certainly a frequent idea across time. Or that it was contaminated water. And prevention, as you can see in this poster, really focused on staying clean, both morally in terms of drunkenness, but also in terms of keeping your house clean. In terms of cures for cholera, they were talking about castor oil, cleanliness, reducing smells, opium, smoke, leeches. You know what leeches are? Little sort of worms that you may pick up in the water, blah, and laxatives. Now, what's interesting, if we're thinking about cholera spread, is that not everybody was at the same risk. So you see, for example, this really high risk area where there are other parts of this map that are really, much less at risk. And we'll think about that in terms of what's going on here. Here's another kind of map, same area. Again, pump one, water pump. So people are getting their water from a common pump. And the closer you were to this particular pump on Broad Street, the more likely it is that you are going to die of cholera. And people who were at a greater distance were much less likely. Edwin Chadwick said, he was convinced that things like cleaning and ventilation and drainage would make a significant difference. And so he advocated for getting sewage out of the area as quickly as possible. However, and if you want nightmares, if you're at all sort of dirt phobic, do a little bit of reading about what the sewage system was like in the 1850s in London and in any city of that period. Um, so he said, let's get the sewage out. The problem is there wasn't a place for it to go other than into the Thames, the river, um, which then contaminated the water supply, which perpetuated the problem. John Snow came along somewhat later, and he said, okay, yeah, there is this unusual pattern of what's going on in terms of cholera. And he said, not air, but water. And remember, we don't know about the cause yet. And so what he did is he focused on water-based infections. And in fact, the big thing that he did here was he asked for the pump handle to be removed from pump one, which caused a precipitous drop in cholera deaths. Yay, Snow. Now, again, as we're thinking of from a public health perspective, we're going to be paying attention not just to what's going on in Broad Street, but we're going to be asking, so why aren't there any deaths at this workhouse, which was probably dirty? There were a lot of poor people, maybe morally debauched people. Why were there a lot of deaths here at this very well-to-do estate? And, you know, they argued that there were more deaths at some of the on upper floors, again, attributing it to moral debauchery, and less on lower floors. Now, one of the things I want you to be thinking about is probably, from what we know about housing at that time, people who were shop owners had some of the lower floors or lived in the lower floors. They had more money and more space. And people who were less wealthy lived on some of the upper floors. And they tended to be much more packed in. Okay, so let's bring this together. This is Nadine Burke Harris, the author of your text. And she says, if 100 people all drink from the same well and 98 of them develop diarrhea, I can write prescription after prescription for antibiotics. Or I can stop and ask, what the hell is in this well? And that's what we are doing this semester, is saying, what the hell is in this well? Why are there these these sorts of problems? And what can we do about it? So she says, the single most important thing is recognizing what the problem is, in the first time. And that's what we're going to be looking at. Take care, and I will see you in the next